mamas, and welcome to my video on how long you should breastfeed your baby. Breastfeeding is a personal decision that every mother makes for herself and her baby. In this video, I'll go over some of the benefits of breastfeeding, the recommended duration of breastfeeding, and factors to consider when trying to decide how long to breastfeed your baby. Hey, it's Morgan, and welcome to the Passable Parent channel. Before we get started, don't forget to like, subscribe, and turn notifications on so you don't miss out on any future videos. First off, I want to talk about the benefits of breastfeeding. Breastfeeding offers many benefits, both for you and for your baby. Breast milk contains all the nutrients your baby needs for healthy growth and development. Breast milk also contains antibodies that help protect your baby from any future illnesses or infections. Breastfeeding can also promote bonding between you and your baby and may even lower your risk of certain health conditions like breast cancer. So diving right into it, one of the top asked questions by moms is how long should I breastfeed? The World Health Organization recommends exclusive breastfeeding for the first 6 months of your baby's life, followed by continuously breastfeeding alongside complementary foods until your baby is at least 2 years old or beyond. The American Academy of Pediatrics just changed their recommendation from 1 year to 2 years and beyond as desired by mom and baby. Now, there are some factors to consider when trying to determine how long to breastfeed your baby. The first is your baby's needs. Every baby is different and may have different needs when it comes to breastfeeding. Pay attention to your baby's hunger cues and their growth and development, and adjust your breastfeeding routine as needed. The second is your lifestyle. Breastfeeding can be time-consuming, especially in the early months. Newborn babies want to nurse every 2 to 3 hours, so this can be really time-consuming. Consider how breastfeeding fits into your lifestyle and whether you have the support you need to continue breastfeeding. Support is a major factor. Breastfeeding is hard work and it's just not for everybody. And what can be really helpful is having a really good support system and people in place to help support you through the tough times. And that goes throughout all aspects of parenting, not just breastfeeding. Another factor to consider is your comfort level. Breastfeeding can be physically and emotionally demanding. Consider your comfort level with breastfeeding and whether it's causing you discomfort or pain, and if so, who you can reach out to for help and support. I make a ton of videos on how to help in those early beginning stages of breastfeeding with pain and discomfort, mastitis, clogged ducts, tons of videos on breastfeeding. So make sure you're subscribed to the channel so you don't miss out on any of those videos, and reach out to a lactation consultant near you. Ask your doctor for a referral if you're still struggling with breastfeeding and you want to continue. Another factor to consider is your personal goals. Ultimately, the decision of how long to breastfeed your baby is a totally personal one. Consider your personal goals for breastfeeding and whether they align with the recommended duration of breastfeeding. The American Academy of Pediatrics and the World Health Organization can recommend ideal breastfeeding for 2 years, but it really all comes down to you and what you feel comfortable with and what you feel is best for your baby. A happy mom usually results in a happy baby, so you have to do what's best for you. And again, if you need any additional support, make sure you're subscribed to the channel. I'd love to help you along your feeding journey in any way I can. So if you have any questions, make sure to comment them down below as well. Breastfeeding, again, is a personal decision that every mother makes for herself and her baby. While the recommended duration of breastfeeding is exclusive breastfeeding for the first 6 months of your baby's life, followed by continued breastfeeding alongside complementary foods until your baby is at least 2 years old or beyond, the decision of how long to breastfeed is ultimately up to you. Consider your baby's needs, your lifestyle, your comfort level, and your personal goals when making this decision. Thank you so much for watching, and I wish you the best of luck in your breastfeeding journey. And make sure to subscribe so you don't miss out on any future videos.